So I want to talk to you about complex, so you already know it's a problem, regional, which means it's just in one location, pain, but it's way more than pain syndrome. And I learned this as reflex sympathetic dystrophy, and over time it's clear that this term is not explanatory enough to explain the complexity of the situation as well as the syndromic nature of it. A lot of things end up with complex regional pain syndrome. The prototype, of course, is in people's hands, and so they have all four of the modalities affected. So the required criteria for a complex regional pain syndrome requires that we have deficits in not just the sensory, but in the pseudomotor fibers, as well as the motor, and then temperature, color. So the pseudomotor is the edema component. So they're going to have in your hand, for example, you're going to have pain, and it's going to have edema, be red, and there's going to be motor dysfunction as well, or skin changes that are noticeable, nail bed, hair, that are going to make the diagnosis a combination of not just the symptom of pain, but the signs that there is neurogenic activity going on. So for the face, and that's how it comes to ophthalmology, there are periorbital versions of this complex regional pain disorder. Normally it occurs after some trauma. The imaging studies are usually negative, and the laboratory studies are negative. So it's recurrent bouts of pain, numbness, and then the key and differentiating feature is the pseudomotor and the color. So we'd like to take photographs to document the swelling and the color, which is going to be the redness. So in the hand, that's kind of easy to do. In the face, we'd like to have selfies taken so that we can see the asymmetry. The pseudomotor manifestation is edema, and the color, the redness. So it'll be hot, red, swollen, painful. Those are the inflammatory symptoms and signs. And now you can see why we used to call it sympathetic, mediated reflex sympathetic dystrophy, because it was thought that the vasodilation phase of the sympathetics was causing the pseudomotor, the color, and the temperature changes. So it's probably central. There's some mechanism that is central involved here. It's not clear what this is. And then it manifests in a vicious cycle where you get sensory, pseudomotor, motor, and temperature dysregulation as a result of sympathetic activity in the affected limb, usually the hand, but it comes to us as ophthalmology because it can be in your face or even periorbital after minor trauma.